This is Fox 13's Live at 4.
The Intermountain Medical Center Heart Institute's My Heart Challenge is happening right now. 15 firefighters are taking the challenge to commit to a healthy lifestyle to improve their heart health. Sometimes getting your heart health means surgery is necessary. The Heart Institute in Murray has an exciting new tool in their arsenal to treat patients with heart valve disorders who are too sick to undergo open heart surgery.
Okay, joining us right now this afternoon, we have Dr. Ed Miner from the Intermountain Medical Center Heart Institute to tell us a little bit more about this amazing procedure and how some people who wouldn't normally be able to have surgery are now able to.
That's correct.
Welcome.
These valves, they've traditionally, for the last 40 years, they always went in with open heart surgery, which meant a major incision, opening the sternum, and a long recovery and a week in the hospital generally. And for about the last 4 years at Intermountain Medical Center, we've been doing these procedures with small heart valves that can be inserted through the femoral artery in the leg. And often patients go home in just a couple of days, and they save all of the morbidity of surgery.
Can you tell us more about this device? Because I understand that it was approved by the FDA in January of this year. Is that right? So it's relatively new?
Yes, there are two different aortic valves that are approved by the FDA to be inserted through the femoral artery. The most recent one is called core valve, and we're seeing the animation of the core valve being inserted. This valve was just approved in January, and we've been implanting this valve at Intermountain Medical Center with good success. And the study that was recently released showed that patients actually were more likely to survive 1 year after having this valve implanted than if they had an open heart surgical valve.
And you're saying now that since this is really just a relatively small procedure compared to full anesthesia and open heart surgery and the whole bit, it's just a little bitty incision generally in the groin area.
That's correct. Small incision in the groin area, and this valve goes in through the femoral artery. The old valve that is narrowed is pushed out of the way, and the new valve inside of this stent starts working.
And you brought something with you to show us.
Yeah, this is an example of the valve when it is compressed and ready to insert in the artery. That's how small it is. So it goes in a very small tube in the femoral artery, and then it is implanted in place of the old valve, and it's a really great option for a lot of patients.
It's about the diameter of a fountain pen. And it's about the size of an eraser, very small.
That's how small it is.
Any
it's
risks
really
with this kind of surgery? I know there are risks with any kind of surgery, but
yes, this is a serious deal, working on the heart, and a relatively new procedure. But what this latest study with the core valve showed that patients who were randomly assigned to surgery or to have this valve implanted through the artery did better with a minimally invasive approach. So I think over the next few years we'll be more likely to move toward a minimally invasive approach for more and more patients. And
no doubt the success rate is very good.
It's very good.
That's fantastic. Well, very good. Thanks, Ed, for being here. We appreciate it.
Thanks for having me.
Thank you.
Thanks.
So the Intermountain Medical Center Heart Institute's My Heart Challenge continues through June 25th. If you want more information, just go to our website, fox13now.com.